أهلا فيكم متابعينا، حلقة جديدة من برنامج شرايها عليا. اليوم عندي حوار جديد عن علاج السرطان بالطب البديل، مرة ثانية مع دكتور توماس لودي. دكتور عنده عيادات في أمريكا وفي تايلاند يعالج السرطان بالطب البديل. حوارنا بيكون باللغة الإنجليزية، ولكن إذا تروحون الإعدادات على اليمين فوق في 3 نقط تدخلون فيها وتحطون الترجمة العربية، تطلع لكم ترجمة عربية في الحلقة. فموضوعنا اليوم بيكون مختلف شوي، وبيكون إجابة على أسئلتكم اللي شفتها أنا في التعليق على الحلقات اللي قبل. Thank you so much, Dr. Lodi, for coming with us again on the episode. Picking up on a topic that we said we'll cover in a whole episode from last time, I want to bring up the episode of vitamin C, the role of vitamin C with cancer. Specifically, you had mentioned in the episode about cancer protocols that you use, you had specifically mentioned intravenous vitamin C. Now, I've had a case of a woman who had cancer. She had stage 4 cancer. She went to her doctor. She wanted to go the regular route, so they were doing the chemotherapy. And she was also, she had decided to also do juicing on the side. And also she had read up a bit about vitamin C intravenously and how that helps with chemotherapy. She did a few sessions of that. She barely had any chemotherapy side effects. But then when her doctor found out, he stopped it. He stopped her from doing that. He said, you're on this treatment now, so you can't go. So my first question to you, because again, I have a lot of medics watching this and a lot of cancer patients who genuinely research and they're very well educated on that. Is there enough research on the efficacy first of vitamin C during chemotherapy? Let's say you choose to go the chemotherapy route. Does it help with that?
Actually, there is, and there's a paper that I could send it to you now by Skype, but anyway, there's a paper that goes through each chemo and each particular agent along with vitamin C and the results. And in all of them, there may be 1 or 2 where it's not. It shows that it not only made it more effective, but it decreased the side effects. Yes.
But then how, vitamin C, sorry to cut you off, but vitamin C, if the chemotherapy is trying to kill the immunity or kill the immune systems or kill the cancer cells, then vitamin C is raising immunity at the same time. So that's where I hear a lot of doubts from people. You know, how are you raising the immune system while you're killing it?
Right, yeah, and and that's where the confusion, and that's just a misunderstanding, and it's a lack of knowledge and education, because, and this gets into the mechanism of how it works. Vitamin C, ascorbic acid, is made by all creatures except certain animals that get enough of it in their environment from their diets. This is the guinea pig, most of the primates, including us, and a couple other strange animals, a couple birds here and there. But other than that, all creatures, worms, horses, elephants, lions, dogs, make what we call vitamin C. They make ascorbate because it's a fundamental, essential molecule in not only cleaning up what's called free radicals, cleaning up. See, when you get a toxin, usually what it does is it produces a free radical. A free radical is just an atom or a molecule that's lost an electron, and now it's stealing electrons from the guy next to it and sets off a chain reaction. But that's also how the body works. So this is called oxidation. When it does that, when you steal an electron, you're oxidizing. Okay. Now, when you're an antioxidant, which is vitamin C, vitamin A, vitamin E, is giving back the electron. So on basic chemical, so these oxidation and the antioxidant is called reduction. Oxidation, reduction, they get the word redox. So these are called redox reactions that happen in the body. So not only are they necessary to quench toxins that come into our body, okay, but they're also necessary. We use the oxidation in certain conditions. So vitamin C donates electrons, always, no matter what. Okay, it's donating electrons. So it's functioning as what we think of as an antioxidant. However, if it donates an electron to copper or to iron, which exist, copper and iron both exist in 2 different conditions, a 3+ or a 2+, it'll take the 3+ and change it to a 2+, And in that process, it's called the Fenton reaction, it produces hydrogen peroxide, which is a free radical. So in other words, this antioxidant, in the right circumstances, produces oxidation products. It's not an antioxidant, it's an oxidant. And the way that vitamin C intravenously kills cancer is because you have such high levels of the ascorbate, and since cancer cells need copper to make new blood vessels, angiogenesis, and they need iron to replicate their DNA because they're replicating faster, so they accumulate more iron and more copper. So as a result, you have high levels of vitamin C, you're producing all these peroxides. Now, healthy cells it's normal for them to have peroxides, so they have an enzyme called catalase which quickly converts it into water and oxygen. So it's good for them. Cancer cells, because they no longer can use oxygen by definition, no longer have antioxidant enzymes. They don't need them, so they stop making them. They don't have the apparatus anymore. So here they are in a situation where they need the antioxidant enzyme because they're surrounded by hydrogen peroxide and they can't do it, so it kills them. So it turns out to be the perfect chemo because it kills the bad guy and it's good for the good guy. You know, so that's how it happens.
But doesn't that then affect doesn't that then imbalance other minerals such as copper or iron? Or because, you know, when you're introducing a big amount of one thing, surely you're going to cause an imbalance somewhere else.
Right. But you remember, if the amount of copper and iron in a normal cell is a small amount, it's not a large amount, so you're not going to see any large changes in that area. You know, what you're going to see is the normal cells are designed to be protected from oxidation. They have antioxidant enzymes, and that's what they're designed to do. So when you increase the oxidation products, the free radicals in the environment, healthy cells, not only can they do it, but when they're challenged, they actually become more powerful. So just like if I want to get muscles, what do I need to do? I need to break down muscle. I need to work hard and break down muscle, and then I'll grow muscles. It's the same thing. So that's why in an immunity, if we have a sterile environment and we don't get exposed to pathogens, we won't develop an immune response. We're going to have a weak immune system. So we need to have exposure to toxins and all these things. If you want to, instead of getting the measles vaccine, go touch somebody that has the measles, get the measles, and you'll be immune. I mean, this is how you get a strong. So anyway,
to answer the doctor who is saying, I want to lower your immunity, you don't want to take anything that raises it, what would you say?
Well, this doctor hasn't read the research, number one, but number two, if he is to read the research, he'll understand that the reason he's saying that is because the way chemotherapy works and the way radiation works is by producing free radicals. It produces oxidative byproducts. So he's thinking vitamin C is an antioxidant, so it's going to counteract what I'm trying to do with the chemo. And that would be true if I were giving 50 milligrams, 75 milligrams, 100 milligrams. Yes, then I would be protecting the oxidation. I'd be neutralizing it. But when you give it in 50 grams, you're now at the level where it's not an antioxidant, it's an oxidant. So it contributes. It contributes to the.
It contributes to the therapy. So I forgot what I was going to say. So you're saying that the key here in the vitamin C treatment is the high doses, and that's why they're being given intravenously, because there's no way that you can take 50 grams, if you're saying, can take it by mouth. So, and if you could, would you then still be able to take the high amounts by mouth and still have the same results, or it's about to be going into the blood directly?
No, because in other words, if you could take 50 grams and absorb all 50 grams, that's fine, because absorb means it goes into your blood. You just got to get it into the blood one way or another. The problem is our gastrointestinal tract won't allow it. We get diarrhea at about 12 grams, 10 grams, 8, depends on the person. So there's no way we can get it. So we give it intravenously. That way we make sure that we have high levels of ascorbate, which is vitamin C, in the tissues, all the tissues, the heart, the lungs, the breast.
And then would that depend what type of ascorbate it is, like what the source of ascorbate is, natural versus, does that even exist in intravenous vitamin?
Yeah, it does. Well, in alternative therapies centers like ours, we want to get ours made from an organic source. So the sources are corn, beets, tapioca, cassava. These are the main sources. The problem with corn, as you know, is GMO. Most corn in the world is genetically modified. So most people have gone to either organic, certified organic corn-derived ascorbate, or beet-derived, or cassava or tapioca. Those are the main sources of it. Now, the other thing you can do is by doing a simple chemical reaction, adding enzymes in the laboratory and producing ascorbic acid, and it's really going to have the same effect. It really doesn't matter. What you want to make sure is that you don't have anything in there other than the ascorbic acid and whatever the carrier solution is. And you got to make sure, and then when you get, even when we get the ascorbic acid, it's got a pH that's acidic. So when we mix it in the bag to be ready for administration, we have to put in a certain amount of bicarb, sodium bicarb, to neutralize it. We need to bring the pH up to like 7.5, okay? And so if the pH is alkaline now the only time you get a problem with vitamin C at all is that in order, see, an acid means that the positive ion is hydrogen. So it's basically, ascorbic acid could be called hydrogen ascorbate. Okay? So what happens is we add in sodium bicarbonate. So the sodium takes the place, the bicarbonate, and they make a reaction. Anyway, so now you have sodium ascorbate, okay, as the carrier solution. Because the ascorbate is a negatively charged anion. So you have to have a positive. So we exchange the hydrogen, which is the acid, with the sodium. Now we can't give it to you as magnesium ascorbate because you'll wind up dying. We can't give it to you as potassium ascorbate because you'll wind up dying. Calcium ascorbate, you wind up dying. We can't use any, so the safest mineral is sodium. So the problem that's associated with it is you get a very high sodium level, and you can get extremely thirsty, and it causes intracellular dehydration. So what we have to do is sometimes we hang a second bag of a more watered down solution than normal saline. It's called half normal saline, so that we increase the volume, and people need to drink water during it. So even that's not going to kill you, the sodium. It's just going to make you uncomfortable. So, but it's the only way to administer it. So we do that way. We give people they have them drink water, and we might give them an IV first of half normal saline, which means it's more water than saline fluid, and that way we fill up their blood with that. So anyway, that's the only problem. So headaches or any of the other things that might come from it are from the sodium load.
And how do you decide the dosage? Like if you say 50 grams vitamin C or 75 or however high you want to go, is that based on the type of cancer or the stage of cancer? On what basis do you base the dosage decision?
Well, for a long time, and it was very effective anyway for like 30 years at the Reardon Clinic in Iowa. But in any case, we finally found out when they did some studies at the NIH, National Institutes of Health. In fact, there was a tri-sponsored group of studies, the NIH, the NCI, National Cancer Institute, and the FDA. We all know the FDA. They got together and they co-sponsored some studies. The lead investigator was Mark Levine of the National Institute of Health. And they looked at what is the actual mechanism of action by which vitamin C kills cancer. He's the one that elucidated that whole Fenton reaction, producing peroxides, etc. Anyway, they found out that you need to have between 350 to 400 milligrams per deciliter of ascorbate in the plasma to kill the cancer. So, the question is, how do we achieve that in the average person? It differs with each person. So 50 grams of vitamin C might give us that level, whereas this person, it might take 125, 150 grams. Why is it different for different people? Because vitamin C ascorbates, we are all what has been known as subclinical scurvy. We all have subclinical hypoascorbatism. That's it's based, we're not getting enough in our diets, right? So we don't have bleeding gums that you would have from scurvy, which is vitamin C deficiency, but you've got some of the other problems associated with it. So and vitamin C affects immune function, etc. So we give, and the other thing is that the adrenal glands need lots of vitamin C. So the more someone is stressed, they're going to, so let's say you come in very stressed and we find out by doing ascorbate levels on your blood after we give you the vitamin C that you need 75 grams to get therapeutic. Now you're stressed, but now you come to our place of Phuket and it's beautiful and you're not stressing, you're doing yoga and you're meditating, you're eating nice foods and you're at the beach and all you say, and now we find out, oh, we can give you 50 because now you're therapeutic at 50. So it varies. So it depends on multiple factors, but that's how it is. So one size doesn't fit all.
Yeah.
You've got to check.
Yeah. And would you give more for a chemo patient as well because they're technically stressed, the system is stressed?
Again, we look at levels. If we're achieving that level, now if the chemo has affected, the chemo person will probably need more. But we don't look at anything except the level. Did we get the plasma? Because if we have the plasma level, that means we know we're delivering to the tissues the amount we need to kill cancer. So you see now, if you're giving that and a chemo agent, it's a double whammy. You're going to kill that cancer faster.
And what duration are we talking about? Like, let's say somebody comes to you for a week or 2 weeks. They go on vitamin C for that long, and then they go back to their life. Should they be continuing that? And I know it depends on the cancer and on the patient. But what are we looking at roughly? Like, are we looking at a year of intravenous vitamin C or a week, 2 weeks?
Well, depending on the stage of cancer when someone comes, they would stay anywhere from 2 to 16 weeks. It really depends on the stage and all that, so it really depends. Now, what I advise and what we have practiced for 20 years in the U.S. and is that when people leave, we try to find a practitioner in their area that can still administer vitamin C to them once or twice a week, as long as you can. As long as you can.
Would give them your products, or they would source them where they are, because you can't always find, let alone finding a doctor who is willing to do it for you, but you can't always find the drip itself.
So that's the problem. And there's a lot of countries, especially in the Middle East, that they won't accept the mail. We can't even mail it to them. The person would have to send a courier to come back and forth to bring it in. So that becomes very difficult. So that's why it depends on the country, it depends on the situation. And some people, what they do is they have a nurse in the family, or they have a friend who's a nurse, and under the proper diet, it's just a simple IV, and she learns how to mix it, so you can avoid having to find the right doctor and just do it that way. So, because it's not dangerous if done correctly. Anything done incorrectly is going to be dangerous, breathing oxygen.
Yeah. Well, speaking of dangerous, I'm curious now then, if you say that in high quantities it becomes an oxidative agent in order to kill the cancer cells, I'm curious then how that would affect somebody who does not have cancer cells. Would you then just be creating more free radicals?
Well, yeah, you make free radicals, but which stimulate, so the cells have to protect themselves, and our healthy cells have all of the right enzymes. They're equipped for it. So what happens when you stimulate something? It gets stronger and stronger and stronger. So you're actually making your cells more able to respond immediately to oxidative stress. So oxidative stress is what's happening to us when we eat the wrong food, if we get into an argument with someone, you have an accident, all these things contribute to oxidative stress. So to be able to deal with them better would be the high doses of vitamin C. But you wouldn't want to continue to give 50, 75 grams twice a week to someone who doesn't have cancer. That's unnecessary, And so once a person gets back, gets stabilized and all that, then you can maintain your antioxidant vitamin C by taking it orally. Anywhere, depending, 8 to 15 grams a day orally, divided doses. And how do you know you're taking too much? You're in the bathroom all day.
So any excess would excrete out in the bowels if you had excess. And is there a specific type of oral vitamin C that you would recommend to somebody who does not have cancer and just wants to maintain?
Right. Well, you can get just pure ascorbic acid powder. And then they have buffered, which means so that you don't get as much diarrhea. And the reason you won't get as much diarrhea is because it's not all sodium ascorbate. There's some magnesium and the potassium ascorbate. Remember, you can't give those IV, but you can give them orally. So it's buffered. And now there's a new type of vitamin C is out, and it's a lot of health products are using it. It's called liposomal C. And that's where they encase it into very little small membranes, which allow you to take higher doses. They get absorbed into the blood without causing a problem. So you can actually get really good high levels with liposomal, Lipo, SOMA.
But then preferably not for a cancer patient. You're saying it's the cancer patient should take it intravenously, right?
Yes. Yeah, because you still can't.
Yeah. Well, I hope this answered a few of the questions that were asked in previous episodes, because we had a lot of questions about intravenous vitamin C, and this I think sheds a lot of light on that. So thank you for the precious information as always. I want to talk about in the next episode, hopefully we'll have time to do that, I want to talk about the role of biopsy and lumpectomy in possibly spreading cancer, because this is what you don't hear enough of. Cancers, do they spread with biopsy or not? We're going to answer that hopefully in another episode, in the next episode. So you don't go anywhere. But for whoever's watching, please put your questions in the comments, and we'll answer them hopefully in future episodes. شكرا لمتابعتكم. مثل ما قلت حطوا أسئلتكم في التعليق، إن شاء الله أنا أخذ أفكار الحلقات القادمة من تعليقاتكم على الحلقة نفسها، فنشوفكم إن شاء الله في الحلقات المقبلة. شكرا لكم.